So welcome everybody. Thank you so much for coming to both our in-person and online attendees. I will admit the online attendees for this to work. One second. Okay. Great. So welcome everybody to this edition of the Care Economies in Context speaker series. My name is Ben. I do knowledge mobilization here for the Center for Global Social Policy. I'm here to give an introduction to our presentation and co-presenters. But before I do that, I want to do a land acknowledgement. So we who are here in person are situated in Toronto, also known as Toronto. These lands have hosted human life for 14,000 years, are the estimates, non-human life for millions of years before that. And it's very important, whenever we're talking about social policy or making structural changes to make life better for both human and non-human life here on the planet, that we acknowledge the lands, the waters, the air, the skies. And many of the Indigenous First Nations who are still here have currently stewarded these lands for thousands of years, including the Haudenosaunee, Huron-Wendat, Petun First Nations, Anishinaabe. And what's relevant in acknowledging both the treaty holders here, the Mississaugas of the Credit First Nation, and the other Indigenous nations who have had relationships with this land since time immemorial, I think is to think about Indigenous conceptions of care. And the little I know about it, that my Indigenous friends and scholars have taught me, is that in many Indigenous societies, care is not something that is adjacent or tangential to how a society runs. It's really woven into the fabric of how a society is organized. And I think, living under colonialism, we need to not only learn from those conceptions of care as if they were in the past, but really use them in advancing a decolonial and anti-oppressive approach to care and caregiving. And so that's why this intersectionality-based approach that both Kayla and Erica will be teaching us about is so important as we look towards conceptions of care that really work for everybody, that really bring care into the fabric of the society. So with that, I will do a little bit of housekeeping. We are here both in-person attendees, please help yourself to snacks in the back. If you're on Zoom, we are being treated to translation, to live interpretation into Spanish by our wonderful translators. And you can access that by going to the interpretation section of Zoom and selecting either English or Spanish. Thank you to the Global Alliance on Care for connecting us with pro bono interpretation. And with that, I will introduce the talk for today. So unpaid caregiving is on the rise in Canada. However, less is known about whether and how policies in Canada are addressing their needs for support. So the paper we'll hear about today analyzes caregiving-related policies at both the federal level and across 6 Canadian provinces, with specific focus on supports for unpaid caregivers. We'll be hearing from Kayla Benjamin and Dr. Erica de Ruggiero. So Kayla is a PhD candidate in health systems research at the University of Toronto and a Vanier Scholar. Her research interests include health and social care policy, care work, and women's health. Before her PhD, Kayla received an honors bachelor's, what is this?
Of medical sciences.
Of medical sciences.
What is that? Yes, no, that's what I get a lot.
In interdisciplinary medical sciences at Western University, and a master's of science in public health and health systems from the University of Waterloo. She's currently working as a research assistant on the Care Economies in Context project and as the lead RA for the Caring Across Generations project. Outside of academia, Kayla works with Misinformed, a national nonprofit organization she co-founded in 2020. Misinformed is a youth-led health education and advocacy platform that crafts resources from an intersectional and community-informed lens. And Dr. Erica de Ruggiero is the director of the Center for Global Health. She's the director of collaborative specialization in global health and associate professor of global health, social and behavioral health sciences, and cross-appointed to the Institute of Health Policy Management and Evaluation, Dalla Lana School of Public Health, University of Toronto. She is also the co-director of the WHO Collaborating Center on Health Promotion and editor-in-chief of Global Health Promotion. She was inaugural Deputy Scientific Director, Canadian Institutes of Health Research, the Institute of Population and Public Health. She's a global public health systems and policy researcher whose research focuses on the political and social influences affecting equitable policy progress in the context of the Sustainable Development Goals. Her research also focuses on evaluating the health and gender equity impacts of policy and program interventions using implementation science and assessing governance effectiveness of global institutions and public health systems. As an educator, she is deeply committed to teaching and mentoring our next generation of global health researchers and leaders. So with that, I will hand it over to our co-presenters.
Wonderful. Thank you so much, Ben, for also putting this all together. Eric and I will also, oh yeah, sorry. Let me know if you can't hear me. I feel like I'm screaming if I talk too loud, but yes. Okay, so before we begin, Eric and I will also give a little bit of context as to how we're coming into this project and our positionality in the care space. Caregiving for me, and the study of caregiving is deeply personal. Not only do I firmly believe that how we take care of people in our society is a show of our society's heart, but I also have experienced caregiving for my late grandmother, and both my grandmothers were caregivers the entirety of their lives. So they worked in child care, they worked as domestic care workers, and I feel very passionately about the treatment of caregivers, having grown up hearing their stories. And I feel very privileged to now have other caregivers share their stories with me as an RA that's been working on caregiving projects for the duration of my PhD. Erica, on to you.
Great, thanks. And thanks so much, everyone, for being so interested in this topic. And thanks, Ben, for helping us get here. So you've heard way too much about me already, but just a little bit about me personally. So how I've come to this first professionally has been through a very deep interest in working conditions, both paid and unpaid and precarious working conditions. So my PhD actually was looking at policy in relation to decent work at the global level. And so I continue to, that bit wasn't included, but it is still a connection to this. And as we know, work is deeply gendered. And so I think that's also another reason why this project is particularly meaningful. On the personal front, I am sort of this person in a way, or amplify the caregivers that we're actually putting the spotlight on, which are those who have both kids and older adults. And so I'm really the proud mom of two kids, adult children now, but they'll always be kids to me. And so, and then having a mother who my brother and I have the great privilege of co-caring for, who's been through a number of challenges and that we've been able to maintain in her home all this time. And that's, I think, sort of an experience that has profoundly sort of shaped me as a person. And you may wonder why we're sharing all these details. Well, it's both important for qualitative research, and I would argue quantitative as well. But it's also very important because of the lens that we're applying to this project in terms of the intersectional lens. And I would say the other reason, this is deeply personal, is because I also was very responsible for taking care of my partner, who unfortunately passed away a few years ago, but had some chronic conditions. And during COVID, this project really was born out of the idea of have care configurations actually change during COVID. So just a little bit about me. And so if you have further questions about the bigger project, Sherry's here and she can fill in the blanks. But I did, before we jump into this project, it's been alluded to by Ben, but I did want to mention that our wonderful colleague Ito Peng, who leads a project on the care economy. I was really honored to be asked to be part of that project a few years back, and she was able to secure a large SSHRC grant to help sort of better understand care in different contexts, as the project name suggests. And out of that project came this idea that it would be really interesting to look at sort of the mental health impacts of caregivers, particularly caregivers who are sort of dealing with both extremes, younger children and also older adults, and or people who experience different disabilities, formerly known as the sandwich generation, although that term has kind of fallen out of favor. It doesn't really do justice to it, and we'll come back to that. That's a little bit about how we got here and what sort of gave birth to this project. And we were very fortunate to be able to get funding from the Social Science and Humanities Research Council of Canada. And there are several co-PIs who are part of this project. And so that's sort of the acknowledgement. So the way it's going to go is that I'm going to start off and provide a little bit of background on the project, the rationale, and tell you a little bit about some of the key concepts that are informing our work. And then Kayla will launch into the research questions and how we're answering them. This is a multi-pronged study, so we're not going to be talking about all the methods that we're applying at the moment because some are yet to be deployed. and and then we'll sort of wrap up with conclusions and preliminary policy recommendations. They are preliminary. I'm putting that emphasis. So I think when we do have the Q&A, would really welcome your feedback on how they're being framed up, right? And also if there are suggestions on how we might want to refine them. So good academics would not be here without good definitions. I mean, this is fraught, I would say, first of all, and we had to sort of land somewhere and kind of anchor our work in a definition. But I think for those of you who work in this space or starting to better understand what do we mean by care and who's being cared for, and what does the caring journey mean, it can take on different forms, and also adding the dimension of unpaid care. So this is a definition, at least in Canada, that's been used, and I'll give you a chance to read there. But in terms of defining the two concepts, the first being unpaid care, we're using Statistics Canada's definition here, and it really refers to the care or assistance provided to individuals, family members, or friends. It really puts the emphasis, as one would expect, since it's unpaid care, on the lack of financial compensation. And often, although not always, this is due to a prior personal relationship, as I think we both kind of exemplified. And it includes a number of different dimensions like duration, which can be episodic or continuous, depending on the nature of the care. Which speaks also to regularity and intensity. So I think it's a good enough definition for us to work with, and I think given this work is still quite emergent, I would say this is also an opportunity to refine these concepts. But that's our starting point. So just to add the layer, and we sort of talked about this a little bit, this project really hones in on this idea of multi-generational caregiving. And it refers to people who are providing care to multiple dependents who may have varying needs, as I think both of our stories, I think exemplified. I should, have a little shout out to my own kids who actually have played a very important role in the care of their own grandparents as well. But, when you start out when they were younger, my kids were cared for by my parents, right? So I think there's this really nice kind of cycle there. So just to really better explore that multi-generational dimension. And so, of course, it can include children, seniors, kids, and also adults, and also I would argue increasingly children and young adults with one or more disabilities, which then prevent them from being launched into the workforce. In many cases there are services that result in sort of having a number of kids or young adults who fall between the cracks because of disabilities that they experience, and they age out of systems. And although that's getting a little better, of course, that really depends on where you live. And so I think we're taking a very holistic or broad definition. So just a little bit of background, and these are just a few stats. So as we've mentioned, unpaid care work is really critical, but it's often overlooked as a pillar of health and social care systems. So as the stats on this slide suggest, and I would probably suggest that this is probably an underestimate. Like, I think Statistics Canada is, doing a great job and has been an amazing partner in the broader project that ETO leads, trying to better getting an quantifiable estimate of what the percentage of adults living in Canada that actually provide what we call unpaid care to different individuals that are listed there. And then the 5 to 6%, which may seem like a small number, is what's been estimated, at least in the last couple of years, are considered multi-generational based on the definition I just provided. And as a good public health person, I'm going to tell you we have lots of demographic shifts. Everyone knows that, but I mean, this is putting a lot of strain on our health and social systems. And so there's going to be an increase, rise on sort of alternative forms of care, which will include unpaid care, in part because of our aging population. And yes, the good news is we're living longer, but that also comes at a cost to different systems. There's a rising rate of disability. Many people are, handling one or more chronic conditions. Some of those are actually invisible chronic conditions, and also mental health conditions. I would say that the other issue is that we're coming out of a pandemic where mental health, I think, and the needs for mental health services were really, I think, are becoming more acute. And that's not just for those who are caring for others, but also those they are caring for, right? Including young and other adults. So next slide. So in terms of the costs, because of course, any policymaker will ask you about the costs. So I think there are financial, there are many different forms of costs, but the two we're honing in on, given the scope of this project, are financial. So this is sort of a typical estimate that over a typical caregiving period, and I mean, we would probably challenge what does typical mean, but we have to start somewhere. It's usually 5 to 7 years, and caregivers themselves can spend tens of thousands of dollars of their own personal resources and money on care-related needs. So that can also translate into opportunity costs such as loss of employment or underemployment or needing to leave the workforce. So you can see sort of why I'm also particularly interested, because of the connection to work. And the more precarious your work is, the more likely you're going to be vulnerable to these kinds of arrangements. And then about 66% of working, what we're calling multi-generational caregivers actually do report this cutback, right, in hours that they've had to contend with to be able to accommodate their caregiving responsibilities. We also know, and Kayla is, has just completed the mother of all scoping reviews. So I'll call it that for short. 23,000?
33.
33,000 articles. Yeah. No article was left untouched, but not all were included in the end. But really trying to get a better understanding on that relationship between caregiving and caring and mental health. And we do know that it is associated with a greater mental health burden, which can manifest in different ways. So, yes, stress, anxiety, depression. It can also manifest in things like, I'm not going to participate in leisure time because I'm exhausted, right? And so then that can have a mental health impact, right? Because we also know that physical activity is actually good for your mental health, but you may be so exhausted that you can't even take that on. Next slide. Good. Okay. So just a few more, and then I'll pass it on to the main act here. So The other concepts that we wanted to review are, of course, gender, and we've both mentioned that care work in Canada is highly gendered, and not just in Canada but globally. And we know based on the evidence from different sources, including StatsCan, that most of the caregiving is done by women. I would just add a note that that's women who identify as such. I think increasingly we need to do a better job of not treating gender as a binary here, and so to really think through what does that mean for people who identify based on different genders. So I just want to mention that. And then the other is immigration status, which, as we know, can very much influence intergenerational living arrangements. So I think for many people who are immigrants or even second generation immigrants, there's this expectation that is often built in. Yes, your mother-in-law will move in with you, or you think about the housing arrangements that you might be able to afford in some cases to allow for that person to even be in your home, or you live close by to them. Like the decision I made actually, so that my mother is actually 5 minutes away. So I think those are things that, are expectations, not for all. And I'm not trying to put a value judgment here because it can come at a great cost. But I think it's really important that immigration status is considered when we're thinking about unpaid care, and that it can vary by immigration status. So this is sort of a map of the Canadian care policy landscape. And so I'm not sure if we have people joining from outside of Canada who are not familiar with Canada. We are not the 51st state, just saying, you're here exactly. We are a sovereign state that is on, it's the only political comment I'll make, at least for now. But just to outline that there are Canada, like for those of you who work in the health space will know this, that there is no one public health system or one healthcare system in Canada, and it's because of where the role of different jurisdictions. However, the federal government does have a role to play, and even though Canada is the decentralized federal state, and that means that significant responsibility is assigned to different jurisdictions. So I'm talking about the provinces and territories. It the division of power isn't always that clear, I would say, and I would say that in areas like this, it's probably still emergent in some cases. And you'll see that when Kayla presents the preliminary results from our scan. And I would say that the federal government historically has not played a very strong role in direct care policy development. And I think that's partly because typically the provinces and territories and the levels of government below that tend to be more in the space of direct care provision, or are provided funding from the federal government to then take that on because they're, quote, closer to the people. So, I think this decentralized structure that we call Canada actually provided a really great opportunity for us to do this comparative policy research, so within Canada. And so we're taking advantage of that by identifying and comparing care policies, not just at the federal level, because some federal policies actually are quite interdependent with provincial and territorial policies and vice versa. So it's important to look at both. And then due to scope, and I'm sorry if the province you're joining from is not in our scan, I apologize in advance, but in addition to the federal scope, which we felt very compelled to include, we were only able to look at 6 different provinces, and Kayla will explain why in a moment, why we picked those, but also it's also a scope of the project. We had to make some decisions like we always do in research. So just very briefly, as the title suggested, we use the intersectionality-based policy analysis. And I'm sure most of you are familiar with intersectionality, but if you're not, just very briefly, Kimberly Crenshaw sort of first coined this concept of intersectionality, and it really aims to interrogate the experiences of people and how they're shaped by in the intersections between multiple social categories. So while we talk a lot about gender, we want to think about how gender intersects with socioeconomic status, geography, race, ethnicity, sexual identity, and so on. And so it's really, I think, provides a really important framework for which we can analyze both the strengths, but also many of the gaps in the policies. I'm not going to go through every single thing here, but just to quickly orient you to the slide. So on the flower looking thing, I guess that's what we'll call it, just kind of speaks to the different dimensions. One I'll call out is reflexivity, which is exactly why positionality of the researchers is really important to be explicit about. The framework attends to power and the power differentials. And then finally on the right, we have descriptive and transformative. So these are a series of questions that you can ask of the policy documents to better understand what is being enacted, what is being said or not said, what are the silences. And so a descriptive question would be, for example, what is the policy problem, how it's characterized. And then on the transformative side, this is really around the action, right? Moving beyond the performative. This is often where you see more progressive policies actually doing better. And so we chose a subset of questions from both to be able to assess how well intersectionality was being reflected in the different policy documents that were analyzed. And there were a lot of them.
Yes.
So I'll turn it over to Kayla to take us through the research.
Great. Thank you, Erica. So from the 8 questions that are asked as part of the intersectionality-based policy analysis framework, for today's presentation, we're focusing on 3 questions that we've adapted from those. So the first being, what are the current policy responses to the problem, in which the problem is the burden of unpaid care and costs of caregiving? How does eligibility affect access to current supports, and where and how can these existing policies be improved? So as Erica mentioned, this is a multi-pronged project. What we're presenting on today has 2 phases of methods for our policy analysis. So in our first phase, we were responding to research question 1, where we're trying to identify care-related policies at the federal level, and Erica's mentioned in 6 Canadian provinces. So those are Ontario, Quebec, British Columbia, Alberta, Nova Scotia, and Newfoundland and Labrador. We selected these provinces to reflect Canada's regional diversity, population variation, and contrasting political and policy traditions. So an example being that Quebec is, of course, recognized for their publicly subsidized childcare model that served as an example for the larger federal policy that we're seeing roll out. So that was, of course, an interesting province to include. And then similarly, Nova Scotia has a targeted caregiver benefit that was of interest. We set parameters for what constitutes as a care policy in alignment with Oxfam Canada's policy scorecard. So for those joining from outside Canada who might not be familiar with that scorecard, it is an assessment tool that Oxfam Canada developed to assess caregiver policy at the federal level in Canada. It's also being adapted now by the Ontario Nonprofit Network for the Ontario context, but they just looked at federal policy. And they rooted this scorecard in the ILO's 5R framework, which advocates for policies that improve conditions and social protections for caregivers by recognizing, reducing, and redistributing unpaid care work. So those fall in our focus because we're looking specifically at unpaid caregivers, but also rewarding and representing paid care workers, because Oxfam did look at policies that also impact paid care, and again, all at the federal level, and we have a provincial lens to our analysis. When we started to map the care policies in Canada, we found that we could further categorize these policies into care receiver-oriented policies and caregiver-oriented policies. And of course, some of these feel a bit more cross-cutting. We can take the example of long-term care subsidies. With a long-term care subsidy, you're fulfilling care need of the care recipient by giving them access to formal care. But of course, also now that serves as respite to the unpaid caregiver who might otherwise be taking up that care responsibility. So the way that we've tried to delineate is with caregiver-oriented policies, we want those to explicitly be addressing the caregiver. And we'll get into some examples of those to help demonstrate this division. So at the second phase of our methods, we addressed the latter two research questions. And here we were looking only at the subset of caregiver-oriented policies. So I'll first get into the results of the first phase, where we looked at the policy responses to the problem at the federal level in 6 provinces. In this mapping exercise, we found 86 caregiving policies, 12 at the federal level, and between the provinces, the most coming out of British Columbia with 17 care policies. And for the care recipient-oriented policies that we found that they're very specific to who the care recipient is. So in Canada, we have child care policies, we have senior care policies, and then we also have policies supporting individuals with disabilities. Among the childcare policies, one of the most notable would, of course, be the Canada-wide early learning and childcare system. So again, if you're either coming from outside of Canada or unfamiliar with this initiative, this was something that our federal government rolled out in 2021, and it was developed through bilateral agreements with 12 provinces and territories, so all except for Quebec in Canada, because Quebec already does have their subsidized childcare model. And they also created an agreement with Indigenous partners, including First Nations, Métis, and Inuit governance organizations. And the goal of these agreements was to, one, reduce average childcare fees to $10 a day across the country, two, to increase the number of high-quality regulated childcare spaces in Canada, and three, to increase access to before and after school programs as well. So this had an implementation timeline up to 2026. So of course, having started in 2021, we've seen a lot of progress, but it's still continuing. And this national strategy has inspired transformation in provincial care landscapes. So we've seen changes in the care policy landscape as a result or consequently from this larger initiative, such as with Alberta, that has transitioned from an income-tested subsidy model that they initially had for childcare to now offering a flat fee structure. In Ontario, we also have seen an implementation here of provider-level funding, as well as parent fee caps for childcare. And Quebec, of course, remains a reference point for the national system. They actually offer childcare, regulated childcare at a fixed daily rate of $8.85, so even less than the national target average. When it comes to senior care, provinces have taken a variety of approaches to support aging populations in Canada. We've seen policies that include income-tested subsidies such as housing supports in Alberta and medication coverage in multiple provinces: Alberta, Ontario, British Columbia, Nova Scotia. We've also seen provinces offer programs that help seniors access formal care supports, including home care and long-term care. So an example would be provinces providing home care subsidies that help families to hire personal support workers to come into the home to supplement the unpaid care that's happening in the home, or others offering financial assistance to help seniors move into long-term care facilities. A particularly unique and recent example comes out of Newfoundland and Labrador with their Seniors Health and Wellbeing Plan. So this is a plan that provides in-kind supports to seniors that want to age in place and remain in their home. So these in-kind supports include like snow removal, grocery delivery to the senior's home. So it's just removing certain responsibilities of care that allow them to remain in place.
We have a request to
Oh, yeah.
slow down.
Oh, sorry. Yeah, I will do that. Apologies. And I know Spanish is so fast, so I'm yeah, probably giving them a very hard time. The third major pillar of care recipient-oriented policy that we have focuses on supports for people living with a disability. So across the 6 provinces that we looked at, we see a mix of financial assistance and service-based programs. So in Alberta, one example is the Assured Income for the Severely Handicapped. This program provides financial assistance to individuals living with a disability in that province. And in Newfoundland and Labrador, we have a special child welfare allowance here in Canada that supports access to residential and daycare center services for children with disabilities. Our second category of the care policies were those focused specifically on the caregiver, so caregiver-oriented policy supports. And these are going to be the focus of the remainder of our presentation, as these were the ones that fall into that phase 2 analysis that we conducted. So these would be policies that explicitly target informal caregivers. They're ones offering forms of support such as financial compensation, leave entitlements, psychosocial resources, and respite services. So in contrast to the dense infrastructure that we saw with the caregiver or care recipient, oriented policies, caregiver oriented policies in Canada are much newer and much more unevenly distributed across the provinces. Quebec stands out for having the most systemic approach since they passed the Act to Recognize and Support Caregivers in 2020. We've seen a lot of initiatives come out of that province, including refundable tax credits for caregivers. We've seen a $60 million investment into psychosocial supports for caregivers, and we've also seen major investments into respite care for caregivers. Nova Scotia and Newfoundland and Labrador have also moved toward direct financial support for caregivers. Both offer $400 a month for caregivers, and Newfoundland also offers a paid family caregiving option. So this allows non-spousal relatives to be compensated for care that would otherwise require institutional services or supports. In contrast, in Ontario, and in BC, we have a more fragmented mix of caregiver supports, sometimes embedded within broader programs. So Ontario does have unpaid job protected leave for caregivers. We also have some supports through disability programs here in our province. British Columbia has some respite and peer support services, but access tends to be heavily dependent on care recipient eligibility, their location, and then provider capacity. So these services can be even further limited around eligibility or availability of care providers, formal paid care providers. And lastly, Alberta's caregiver supports remain fairly limited, with some recognition in foster and kinship care through the family support, through the support program for foster and kinship caregivers program. I'll now move into phase 2 of our analysis. So this is where we were asking questions, research questions 2 and 3 of the subset of policies, specifically of the caregiver-oriented policies. So we're asking how eligibility affects access to these current supports, and then trying to think through how they might improve, which is where we offer some preliminary recommendations. But again, we'd love to enter a conversation with you about those because we're still working through them. So we had 86 total caregiver policies that we had identified, and then caregiver-facing policies was a subset of 16 of these policies. And again, I'm not summarizing all the policies that we came across because there were many, but I'll highlight a few. So amongst the limitations that we had found of these care policies, we found that they spanned 5 main themes. The first is that caregiver support policies often determine eligibility based on the care recipient's condition, not the caregiver's needs or their circumstances. So an example of this would be to be eligible for the caregiver benefit that's available in Newfoundland and Labrador. The process is that the person receiving care has to have been assessed by Newfoundland and Labrador's health services, and then they have to be deemed to require significant care as determined by that clinical assessment, and then that would allow their caregiver to now be eligible for this caregiver benefit. Eligibility for care policies may also be income tested or accessible only to individuals who are, in some cases, Canadian citizens, in others, permanent residents, or also in some cases, specifically with tax-related benefits, long-term residents of the province. Second, we found that many caregiver supports are difficult to access because they require strong digital literacy and having to navigate complex bureaucracies. Erica spoke a little bit to the Care Economies in Context project that we've also worked on. So as an RA on that project, I had the privilege of interviewing caregivers, and this was definitely a theme that had come up already in that project around struggling to navigate the institutional barriers or the bureaucracies or the many programs and different places you're going to have to apply and all of the paperwork associated with these caregiver supports. So there's a lot of barriers that disadvantage unpaid caregivers trying to access these supports, especially those balancing multiple responsibilities or who might not be familiar with these administrative processes. Each program typically requires its own intake process, its own application, its own assessment, and then its own supporting documentation. So you can imagine how burdensome it would be, especially for individuals who are eligible for multiple supports. The third theme that we identified was that benefit structures do not adequately scale with increased care demands. Many policies offer fixed benefits. So as I had mentioned, in Nova Scotia and Newfoundland and Labrador, we see a $400 caregiver benefit. This is not something that's scaling as care responsibilities might increase. So that's specifically disregarding multi-generational caregivers who have a double burden of care, as well as individuals who might be caring for someone with escalating care needs, where they may have initially began providing care that they could balance alongside their paid employment, but that might no longer be the case as care responsibilities increase in response to escalating care needs. There is a slight exception of this with the Canada Caregiver Credit, which is a federal policy. That credit does offer, so for supports for more individuals supporting more than one adult with a disability, you can list each person on that credit or claim each person amount for each person on that credit. So that does have some support for multiple care in that specific context. The last limitation that we identified is the absence of coordination across both programs and across provinces. So there's no coordination or shared system across these programs. Qualifying for one doesn't mean you qualify for another, even though a lot of these supports do share eligibility criteria. So you can imagine that for a caregiver trying to access supports, it's very frustrating to be submitting similar paperwork to multiple different ministries or different support intake processes. In addition, with the fragmented system that we see in Canada with our decentralized federal state, different provinces offer different supports. So of course, someone moving between provinces might also now have to go through a complete reapplication to access specific supports. And if they're tax-related supports, such as Quebec's caregiver tax benefit, they wouldn't be eligible depending on the time that they moved for that year. So even moving between provinces could challenge eligibility for some programs in specific windows. And you can imagine that some caregivers might want to be moving provinces if there is a province that stands out for their supports for caregivers, or also potentially for paid employment opportunities that better accommodate their caregiving responsibilities. So from the limitations that we identified, we have 4 main areas of preliminary policy recommendations that we're thinking through. The first is to introduce scaled and tiered levels of support that would reflect the increasing intensity of care needs and also better assist multi-generational caregivers. Because even though multi-generational caregivers are 5 to 6% of the Canadian population, which may also be an underestimation, they're not recognized in any of the caregiver supports that are currently available. So we'd like to see consideration of them and the multiple care burden that they face. And in connection with that first recommendation, we'd also like to see consideration of caregiver responsibilities in establishing eligibility criteria rather than solely having the care recipient's condition be the determining factor. We'd also like to see a reduction in the administrative burdens associated with applying to these programs, such as by creating pathways for portability and coordination across programs that have overlapping eligibility. And this could also be across programs that are available to care recipients and then caregivers. So if the care recipient has to go through certain processes to establish their eligibility for supports, you might also then be able to translate that to meet the eligibility criteria of caregiver supports for their caregiver. And then the last area that we'd like to see improved is also the monitoring of these care policies. We'd like to see monitoring systems established to better collect data and create feedback loops around these policy initiatives so that we can have a continuous improvement of caregiver policies, because we did notice that current data is severely lacking and few, if any, of these policies are mentioning how they're being monitored or have data to support their implementation. So I'll hand it back to Erica to add a bit more to our recommendations and wrap up our last few slides. Sorry.
And
Sorry.
I should speak slowly too. Okay, I will.
Sorry.
Yeah, thanks for that, Kayla. So just to reinforce, these are preliminary policy recommendations. So this is what's emerging right now for us from the data. One additional kind of lens through which I just wanted to sort of talk about these policy recommendations. So irrespective of the topic, often policy can fall into multiple categories. Usually they're universal, right? They can be targeted or they can be a combination thereof. A recent sort of framing of the latter is proportionate universalism. So that means that you know what percentage of people need to benefit relative to having a universal coverage, but you add sort of additional targeted supports that are proportionate to the relative sort of amount of disadvantage that, for example, these unpaid caregivers may experience. So we haven't gone there yet. I'm just throwing that out because those tend to be what's in the, blunt toolbox when it comes to policy making. As we know, none of these policies that currently exist, I think it's fair to say, had a very explicit focus on the group we were particularly interested in. Part of that speaks to recommendation number 4, which of course is predictable for an academic audience, right, to hear this, or academics. But seriously, if the problem is not measured, it doesn't necessarily exist. And as we both said, the percentage of people who might fall into this category, 5 to 6%, is an underestimate, as Kayla mentioned. And so it's still emerging. So it's very difficult to assume that some of these policies would be able to truly address their needs, right? And so we do need that monitoring and those feedback loops to really, I think, inform these different policies. I think the burden on individuals is a recurring theme in many policies. So downloading responsibility, it can be a full-time job to be a caregiver navigator of the person or the people, in the case of the audience we're interested in trying to navigate that. And again, paperwork seems to be the du jour, right? What you end up having to do. But there's got to be ways to streamline that, or to build in, social work supports, for example, to be able to help take the load off. And so I think the other issue is the scale. So I think in Canada, not uniquely Canada, but certainly from the many policy projects that I've looked at, you're not on this topic. Scaling something is always a challenge. And so, but what is being scaled? We want to ensure that it actually is evidence informed. And so this is also really important. Yes, and yes, I just saw the comment. I would agree, navigating and reporting. Yes, of course, yeah, because there's a burden on not just navigating, but also reporting. Yeah, very fair point. And then finally, obviously consideration of what the responsibilities are, because this is why the research that we still haven't done will start to look at that a little bit more, because we don't want to make assumptions that just because you care for either young children or older adults, that your care journeys are going to be very different. But what does that look like if you're doing a bit of both, right? Next slide. Yeah, thanks. So our study obviously has limitations. So obviously it doesn't include the direct perspectives. This was a straight up policy analysis, but I think using a theoretical framework like intersectionality, I think adds to the rigor. But, obviously we haven't yet captured the direct perspectives of policymaking and also of caregivers themselves, which is going to be part of this project, the next phase. Again, it's also based on publicly available information. Now, some may argue, well, of course, therefore, there are secret things happening behind the veil of policymaking. I think publicly available sources are the ones we should be looking at always, because that's what the public sees, that's what people access. And so transparency is really important here, but it is a limitation. And, we also just focused on formal policies. And so that means we can't get at some of these things that are emergent, more informal or community-based supports that wouldn't necessarily be captured yet, right? But this might also be a benefit of monitoring where we start to identify some of these innovations that are effective, and then they eventually make their way into policy because policy is often very reactive to what's happening on the ground. So just in terms of some of our next steps, so our plan is to submit this paper, which is, in the works, to Social Policy and Administration Journal. And we'll also be continuing this project, as we've both mentioned. We're planning qualitative interviews with caregivers who identify as being multi-generational, as I defined earlier. I do want to mention that we're not going to be doing the usual interviewing approach. We're going to be taking a much more biographical narrative approach to really get at not what did you do today? What did you do? You plan to do tomorrow? But to try to get at that cumulative kind of experience over time, and also with the multi-generational layer that will bring for the caregivers we're interested in talking to. So that's in the works. And we have ethics approval for that already. So in terms of any sort of other sort of highlights, we just wanted to bring two important recent developments in the Canadian caregiving policy landscape. First, the feds in their 2024 budget included a commitment to develop a national caregiving policy strategy, pardon me, and that's with the guidance of the Canadian Centre for Caregiving Excellence, which I know the larger project has some good connections with, which is great. And I think this is a huge step because it recognizes and supports caregivers at a national level. And we're still waiting to hear about the 2025 budget, although it may take a backseat given the trade wars, but this is the state of affairs. However, I think we have to try to keep this on the agenda because that's, I think, an early win to even have it mentioned in last year's budget. And we'll see if it gets reaffirmed, or hopefully it advances. We'll see. And then the second is the sectoral table on the care economy, which was also mentioned in the 2024 budget. And it was launched in March of this year by the Minister of Jobs and Families. And it brings together leaders from across the care sector. And its role is to inform federal policy on care work. And we're really keen because the ETO is actually a member of this, so we have a mole on the inside. Hopefully we can bring our feeder data and hopefully, it at least provides a lever or a window into starting to influence with some of the data from projects like this one. So I'll leave it there, and we look forward to your questions. We're very serious about hearing your thoughts about the recommendations. They're very broad right now. They're not action to anyone, for the record. I mean, I think that goes without saying that we will add that specificity, but we're just not there yet. But we would welcome your thoughts on who also needs to be targeted by those recommendations. And then maybe if people do have specific comments about the recommendations, we might actually put them back up in case people want to refer to them. But for now, that's it. So thanks for your attention. Look forward to the discussion.
You stop sharing screen.
Yeah, right.
You go into the Q&A.
Perfect.
Thank you. So I will keep a speakers list, and if anybody online wants to speak, I already see a raised hand. Please do use the reaction function in Zoom to raise your hand. And if you're in person, if I could ask you to raise your hand as well. Yeah, so we will start with a question from Chandra Kant Shah, please.
Hello.
Go ahead,
Hi, Erica. This is your friend, Dr. Shah. And, and yes, and I just wanted to have some comments on this project, really, because I am, and give you a little bit background. I'm 89 now, and I'm involved. My wife is a severe dementia, and I have some support system, but I'm primarily, in a way, managing the whole household, including caregiving. Okay, and the question people do ask me about from time to time, am I stressed out or I'm doing this or that or so forth? And one of the in the framework somewhere is missing out something in my mind, and that is like as an husband, it is my duty to look after my wife. Okay. No doubt there are kind of stress and so forth, and there's a whole circle of care there too as well. In my case, it's my family, friends and family, but in other cases, the churches are involved. The temples are involved, mosques are involved, gurudwaras are involved, and so forth. And part of being human and part of being faith community as well has a lot of kind of caregiving there in a support system and so forth. And sometimes we academic always look in terms of the uh, concrete data and this and that and so forth. I understand you are going to be interviewing people and looking at their perspective. So that's something I hope that within your project you will keep in mind, that people as a human being, caring and sharing societies are most important part of it, and everything doesn't count in money at the end. It is necessary. In my case, I'm all right, but in general, while it is necessary, it doesn't become. The second point I would like to make is you talk about the report, the paperwork, and the paperwork when you're spending public funds, you have to show accountability. Okay. And otherwise, we say there is no accountability. So keep that in mind, that somehow that accountability mechanism is there with not too much, but at least there is some way of accountability. Because one of your presenter, Kayla, mentioned that if you don't count, you don't exist. Same way in funding and so funding envelopes and so forth, the accountability is necessary. Thank you. That's all.
Thank you. Well, first of all, I'm very honored that you attended, Dr. Shaw. Thank you. He's a legend in the public health world. So just thank you for your remarks. And Kayla, I invite you to comment as well. But to your first point, 100%, I fully agree with you. I mean, this was a presentation based on policies and how they were represented. And I would say culture and sort of that. I mean, we talked about immigration status. We talked about race and ethnicity within the intersectional framework. We talked about, relationships. All of those things are part of the care experience, but they're not coming through in the policies. So that's why we didn't speak about what you just said, but I completely agree. And I think the other thing that we know from other research is that care is not a negative experience for everyone. I know it's when we talk about mental health burden, yes, it comes across as this is going to be a burden. I'm stressed, but to your point around duty, that I think is something that we're hoping to hear from these caregivers, because we're also going to be interviewing, I think for the first time, people who do both, right? So it's not just those who care for older adults. And you're right that it definitely takes a village. And I think that's again, and Kayla alluded to this, some of the community-based supports that might be already in place, whether that's faith based organizations or other services that might be very community dependent and not necessarily in every place in the country, are things that are really part of that wraparound support. But policies don't reflect those things very often, and without better monitoring. And secondly, yes, absolutely. Obviously, we're not suggesting that paperwork would disappear, but I think there's probably areas for efficiency, and especially when people are having to apply to multiple sources given their needs. And this would, of course, multiply for someone who has multiple caregiving responsibilities. So if we take into account that these people do exist, right, that they're not, that they shouldn't have to go to every single different sector for their supports, then how can we better make the experience a little bit more efficient and less burdensome, while understanding absolutely that we have to be accountable for public funds.
Yeah, thank you so much for your comments and for sharing your experience. I think it's really beautiful how you also called caregiving part of the human experience. I completely agree. And I will say, with the large scoping review that Erica and I had, positive aspects of caregiving did also come through. In that scoping review, we were looking at the mental health impact broadly, not just for the negative mental health impact. And there are definitely studies that have looked at experiences of reward and value and personal satisfaction in relation to caregiving. So we've also been very mindful of that in crafting our narrative interview prompts so that we can hopefully receive like a fulsome understanding of the care experience, both negative stressors, but also the positive ones that you spoke to as well. And with the administrative burden, with some of the interviews that we had with the caregivers, they mentioned how they're also applying on behalf of their care recipient for eligible supports. So even if there was an opportunity to just open channels across care recipient and caregiver supports, there's already the same person completing that paperwork, but doing it twofold. First, to allow for their care recipient to receive certain benefits, but then again, for themselves as the caregiver to now receive those benefits. So we're just hoping that we can see communication channels so that the paperwork isn't repeated, but we completely agree we want taxpayer dollars to be accounted for in the structure. So thank you. Yeah, thank you.
So we have another online question in the queue, but before that, I wanted to read a comment from Pamela Barkhouse, who says, agree, we can also discuss grants versus contributions, whereby grants are recognizing the substance of the project being funded. Contribution is tied to performance and reporting to justify the public purse. I agree as well. We can definitely improve the efficiencies to reporting mechanisms. So now I will hand a question over to Sophia, and then we can go to the in-person questions after. Sophia Trevino has this question.
Address me.
And Sophia, you will just
I'm
have to.
so sorry. I'm so sorry. I couldn't get my screen. So, hi, my name is Sofia Trevino, and I'm with the International Domestic Workers Federation. I want to thank you all for this presentation, for the research, the recommendations of the policy brought into this space. This is more important than ever, I think. But I was really taken aback by some of the numbers that you presented in Canada. And given the significant financial cost of caregiving, and the fact that 40% of adults in Canada provide unpaid care, and the projected increase in demand in the coming decade, as projected by ILO, especially in the global north, is there research that can reflect the role of the platform economy that is causing within this sector? We can see caregiving, care workers apps on the rise throughout the world, and especially here in Canada, from childcare to all these services that were mentioned, like cutting the grass, who's the cooking, who's, that provide services related. So how can we assure that policies that protect care workers, paid and unpaid, can also protect workers as the informal economy is increasing in Canada?
Good. Yeah, that's a great question. And so this work is not going to answer that question, just to be clear, but we should talk. I actually think this is a really interesting idea of what are those services that are operating in the market. So our project focused on the policies, which are government led, right? Then you have sort of what's the market providing in terms of these kinds of services that are emerging, as you said. But more importantly, we do know that, and based on work I've done also for another project, that informal work is on the rise here in Canada. You yourself mentioned that. And I'm not sure if my colleague Tom is online, but she and I and several others did a project a few years ago looking at the gig economy. We didn't look at it through this particular lens, but I think with the rise of the need to access these different services, we need to think about that intersection between the need for care and care supports and who's providing that care, even if it's in a very poorly paid space, and also what they're exposed to in terms of vulnerabilities. So that work on the gig economy looked at sort of different vulnerabilities that these workers actually were experiencing. The problem at the time, and this work is maybe 4 or 5 years old now, the literature was so dominated by Uber and sort of different kinds of sort of gig work. So I think that kind of work would need to be redone to think about sort of workers who are accessing that. So happy to think about that further with you. So it's an incomplete answer, but I just wanted to recognize how important that is. So thank you for asking the question.
Yeah, respond. Thank you.
Okay, and can you just remind us the name of the organization? Because I know you said it at the beginning, because we'd be happy to follow up with you to chat further, or maybe just put it in the chat, Sophia, if you don't mind. I heard something domestic workers, but I didn't hear the whole name, so yeah. Thank you.
Well, Sophia puts that in the chat. I think we had some questions from in person.
And thanks for the great presentation. So I'm the first year PhD student at IBPA focused on the health economics. I'm really interested in the here for a really long time. So when I do some quantitative research, there is a program about the long-term care and the policy. Is that the government or other institutions launch the policy, but because especially for the senior care givers, I think that policy have a question is that because all of these senior adults and their caregivers, they are kind of aged and they are social isolated. So one question is about this kind of policies. The utilization rate is super low. In my home countries or in America, they have a lot of policies to help a lot of help this kind of caregivers, but the utilizations or the uptake is super low. So when I would like to use that quantitative method or data to see how much the policy have helped these caregivers or this senior adults, but we found that from the policy comments or from the research comments, both that the uptake is super low, and we don't think that is a great policy that can be accessed by the quantitative method. So I would like to ask, is there any ways to solve this kind of questions, or is there any ways to identify the question?
Can I ask you all to repeat the question so that into the mic, the salient parts of the question before you answer?
Sure. So, so let me know if I'm misrepresenting your question, but my understanding is whether there's a better way to track uptake of senior care services and policy supports, as well as perspectives on these policy supports, whether they're desired or wanted by the caregivers. So I know in terms of long-term care policy in Canada, we have long wait lists for long-term care. So that for me indicates a demand for that service. But as Eric and I mentioned, there's very few monitoring mechanisms in place. So I think it comes down to that, establishing monitoring mechanisms around these policies so that we can better evaluate their uptake. And I think qualitative research is where you'd be able to understand whether they're the desired policy supports for caregivers. That's what we're hoping to get at with our project. But I know in terms of senior care, there has been some quantitative surveys of folks to understand what kind of supports they prefer between home care and long-term care, and there is a preference for home care. So there's some of that data, but I think we just need better data and reporting mechanisms for this and not shared.
Yeah, correct me if I'm wrong, but I would say also the other dimension is to look at the public and private sort of delivery of long-term care. And the reason I mention that, to relate it back to this work, is that if you may have, let's just say you're a multiple caregiver with multiple recipients. You may have, let's say, an older parent in a long-term care facility, but depending on the kind of supports they provide, there may be still a lot of expectations on family and others, which is fine, to also go fill in and support, in addition to that person being in long-term care. So there's an interaction there between community and long-term care, that the caregiver may actually be in a position to do that. What might be interesting, and we saw this from research actually from our own school, that you're in, right? You're at IBPA, right? That looked at, that people who were in private long-term care facilities had poorer health outcomes, compared to public, right? So why is that? And so I would really encourage you to look at, and I think it's Nathan Stahl and others who've actually done some of that work. So happy to chat with you offline, but I think that I would encourage you to think about that relationship, right? Because it's not just the institutional care that's being provided, but what role are members of the family or others who are coming to not just see their relative or friend or whomever, are they also providing other forms of support? So to supplement what's there. And is that different for public versus private? I don't know. So anyway, up to you. You're in first year. You're still figuring it out. So hope, does that answer or get at what your question? Did we get at your question? Just want to make sure. Okay, thanks.
There's a question in the chat that says, is there research on the role that employers have in supporting caregivers? For example, many employers provide top-ups for pregnancy or parental leaves, but what about caregiver leaves in Ontario?
So we had looked specifically at what's provided by government because workplace top-ups are so variable and usually dependent on the workplace. So around like the policy that you mentioned with employment insurance and parental leaves, we're interested in what's provided by the government as that baseline, but we know it can be topped up and supplemental. So I think employment and workplaces, that's something that Oxfam's scorecard starts to get at a bit as well, how workplaces can be more supportive of caregivers. But we were interested specifically in informal policies, so that fell outside of the scope for this project.
Mm-hmm. Yeah, it's a really good question though, and I think again, maybe I don't think our recommendations may be able to make this call, but we could certainly take it to account. And that is that governments can incentivize workplaces to do this kind of thing as well. So let's not forget their role in encouraging workplaces to take on something like that as well. So that could be also another avenue for change, right? I mean, it's not just one solution, as we know. This is a very multifaceted phenomenon. So
another comment in the chat says, also something to evaluate is the quality of care that is provided in home care versus long-term care facilities and the outcome of the patient's health. How can we put a dollar figure on the quality of care when we are doing a cost analysis?
Yeah, I think that's a very interesting area of research. Part of our Care Economies and Context project was also speaking to paid caregivers. So I spoke and interviewed a lot of personal support workers working in different long-term care homes. And there is definitely work conditions that enable different quality of care. And I think that's a very interesting area of research, but I don't have anything on that from this project. Thank you.
Other questions from the in-person crowd?
So I actually have two questions. I'm sorry to double dip, but my first was whether you were able to uncover or explore why Quebec stands apart in having relatively generous caregiving supports, and then also whether, because you were interested in immigration status and gender, did you see those two factors actually come up in policies? Were policies responsive to those? I would be surprised if they were, but yeah, those.
So I think the first question about Quebec, we'd have to review. Oh, should we repeat the questions?
Yes, if you don't.
Okay.
Yes.
So the first question is about whether we were able to get at why Quebec stands out in terms of their policy landscape. And then the second, in terms of gender and immigration status being important intersections for care that we pointed out, whether the policies were responding to those intersections. So yeah, I think with the first one for Quebec, we'd probably have to do a review of their internal policy dialogues around these caregiving policies to really understand why. But I think from other research in Quebec, there's been a lot of scholars that have pointed to the different cultural values of this province around family. So we've also seen them establish their childcare policy in 1997, much earlier than it hit a lot of other provinces, which might come down to a different value system within culture for the province. They also tend to be a province that operates more uniquely from the rest of Canada. So I think that there might be an interest in innovating within that province because they operate a little bit differently even within the federal structures and arrangements compared to other provinces.
Can I just add?
Yeah.
I mean, it's a great question because, Quebec, the unicorn, and in Canada, I mean, they have historically, and Kayla's already made this point, but just to broaden it to be actually an innovator in social policy compared to others. The question becomes with ongoing influences of neoliberalism and capitalism on policymaking, well, they'll be able to resist that or regress, right? But historically, that's been the case. The only other thing I'll add beyond, you've already covered it, is that they also have a different legal system. So common law is the rest of Canada, and Quebec is under civil law. I don't know if that actually makes a difference or not, but because they've always, made the argument also around being more distinctive. In part, language has helped, but it's broader than that. I think it's led to some other experimentation, right? Another example is they actually have an anti-poverty law, right? And that's been in place for several years. That's quite a innovation in our field in public health. And again, with the caveat that things are not necessarily going in the right direction these days, they've often been pointed to as being the innovators in the public health system. Now, just to be clear, I'm talking about the prevention part of the system, not the whole healthcare system. I mean, I can't speak to the rest of the system, but in terms of how they've structured public health, how it was organized. So historically, they've been pointed to as an example. So there's definitely something going on there, right? So it's a great question. So we'll go to the second one.
Yeah, for the second one. So I think in terms of gender, there are some policies where we saw like the evolution be very gendered, like with paid parental leave initially being specifically maternity leave, and we've seen changes in that policy. But I think an interesting area to explore gender would be an uptake of these policies and caregiver benefits, because we know that the profile of people who are caregivers are predominantly women in Canada. So they're likely also the people accessing these supports and with this administrative burden. But nothing in the policies was specifically gendered aside from that, the history with parental leave. For immigration status, there are definitely policies that are specific to Canadian citizens for access or permanent residents for access. And our intention also with this publication, or what we're planning to do with the publication, is also to publish either on Open Science Framework or as supplementary material to our paper, the entire policy database that we have put together so that can be used. And in that we have our intersectional considerations and whether there were mentions in the policies, but it's very limited, unfortunately, as
you would expect.
We have a comment in the chat from Terry who says, I'm not sure how to frame this, so forgive me, but another segment of the population that needs to be addressed is the self-employed. I looked after my mother for over a year straight as the sole caregiver, only child, with no other family. She passed away in March, and now I also care for my dad, though he is not assessed as needing care. I do not appear to qualify for caregiver benefits, leave, etc., because in order to provide this care, I closed my business. I am now considered unemployed, in parentheses, and don't have the time or resources to determine any supports available to me. All seem to rely on assessed need of the care recipient or employment status of the caregiver. Sorry for the long dialogue, but the formerly self-employed is a segment of the population that seems unaddressed. I'll hand it over to you to respond, but just there was a response in the chat from Krista, who works with the Canadian Centre for Caregiving Excellence, who says, we identified self-employed gig workers, contract and part-time workers as all being outside of the policy or government support eligibility. It's definitely a gap.
First of all, I'm very sorry for your loss, and I really appreciate you sharing that experience. And I mean, I think just to echo what has already been the response, but it actually builds on a question that Sophia asked earlier, which is that there are how you are employed. There are very few people, since I guess there was a review done of some years ago now, but I think it still holds true. It's just getting worse, is that most people can no longer define their working relationship as being having a direct relationship with their employer, right? The employer-employee relationship, which sort of governed many working relationships in the past, is no longer what dominates. We're seeing an increase in, it's not a bad thing to be self-employed. I'm not trying to say that, but it comes, it means that you don't have access to all sorts of other benefits that I would, for example, as someone who's employed by this university. Same thing for gig workers, etc. They tend to be invisible as workers in policy in general. That's the short answer. And so I think anything we can do to elevate, I would say, their considerations through work like this, but also other work, looking at labor policies more regularly at federal and provincial levels is really, really important. And I think you've highlighted one other intersection, right? That's critical. So thanks for raising it.
We have a few minutes remaining for questions. We have another one in the chat. The dialogue is making me wonder if people in need are using AI to navigate or find help resources. It would be an interesting thing to understand.
I'm not sure. I don't know if ChatGPT knows what supports are available in Canada, but I think that with us talking about different communications channels or efficiency, there's definitely a lot of potential for technology to enable a lot of that efficiency within these programs.
I mean, it's a really interesting point, and I guess the one caution I would offer is that it isn't without its perils, and it may be also subject to abuse, right? And so both people who need the care and may use that as a strategy to find it may find themselves in not, finding supports that are not legit. I mean, I don't want to assume that's always the case, but that's certainly a concern. And I would say that there's not a lot of governance around that, right? And so that may be a concern, but it's a really important consideration you're raising, and to have into the mix. Yeah.
Krista from CCCE has a response to that says there are apps that are using AI and chatbots to help navigate resource. One example is Team Care Pal. It's a closed loop chatbot with verified resources.
Okay, so then verified is the key. So thanks for that, Krista. Thanks for the assist, by the way.
Yeah.
Appreciate it. This is a very complex area, so thanks.
Another comment in the chat. Also, there is a gap in data collection of those who leave the workforce to care for family members at home. They also become ineligible for many supports or offerings. It would be good to start gathering this data.
Absolutely. And I think that's also why if we change eligibility criteria a little bit to be more oriented toward the caregiver and the responsibilities that they're taking on, then that might open up accessibility to both the self-employed and then now unemployed as a result of caregiving responsibility populations. So thank you for that comment.
Any other questions or comments from the people in person?
Yes.
I do have a question from a lay audience perspective. So I'm not from Canada, but I'm from China. So in China, I'm a daughter and my mom has rowdy symptoms in menopause. and I have to take care of her. So in China, we have this policy or law that our next generations have the obligation to take care of your parents.
Mhm.
And if you don't give them enough support or mental support, financial support, they can actually sue you. And it's illegal to not taking care of them. So that's
Wow.
kind of pressure we are having.
Wow.
Do you think this policy, I'm not sure if Canada has this kind of social norms or policy, but do you think this dynamic relationships between care receivers and caregivers can really impact the caregiver themselves, health or financial status, everything? Because for me, I'm highly impacted by that.
I know, I can imagine. That's very interesting. And I remember reading too about China's 97-3 model, where they're wanting 90% of senior care to be in the home.
Mhm.
And then I can't remember if the seven, I think 3 institutional or 7, maybe home care support. So I think that there definitely seems to be a push then from multiple policy angles to encourage unpaid caregiving. I don't think that that's necessarily the case here. Like, I think that there are a lack of formal supports, which automatically increases the amount of unpaid caregiving because people don't have the option of paid formal support or can't afford paid formal support, or there's long wait lists for childcare or for long-term care. So the care still needs to be done. It doesn't stop just because there's no paid support option available. So that puts a lot onto unpaid caregivers, whether they see it as a duty that they like to fulfill or now just an obligation that they have to take up because there's no other resources. I think is variable because we're such an immigrant rich country as well. And there's a lot of different cultural elements that factor into how people view their caregiving responsibilities. It's very, very different here. We definitely don't have anything that extreme policy wise.
Yeah, and I mean that I had not heard of that before, to be very honest. I would say for 2 reasons it would not, I should say never is never. That's actually a dangerous thing. I doubt it would happen in Canada for a couple of reasons because of our decentralized structure in terms of which poses a lot of challenges for coordination and whatnot, as we've talked about already. But the other is that I think over time we've seen less emphasis on very few exceptions where legislation is used to mandate things. It's a much more voluntary system, which again comes with a lot of challenges. So I would say, given sort of the way in which policy making happens in this country, which can be as painful as watching paint dry sometimes because it doesn't happen fast enough. I I don't think that would be an option that would be, I think, palatable also for this country, but that's quite interesting. I think the principle, right, around, who is responsible for caring for the people who need the care and the people who are caring for them, right? Which is the spotlight we're trying to also put on, you know, people who are being cared for will be as healthy as those who are caring for them too, right? I mean, there is a relationship there, but how we do that, so that duty to care, and Dr. Shaw spoke about that at the beginning around the circle of care. Right now, I would say nation states, including ours and the provinces and territories, so the feds, are not stepping up to the plate, right? So, and we pay taxes in this country, and so what can they do better, right? So,
I will also just add in the literature that we've seen that the mental health burden of care does vary depending on how people perceive their care responsibilities. If they do feel that it's a way of giving back to their parent or they have that sort of a perspective, usually they report less of a mental health impact compared to folks that feel like it's an obligation or forced upon them. So I think it is interesting to think about how policy might force it on some folks, and then that could worsen the mental health burden.
yeah.
For
That's right.
caregivers.
The perception is, of course, important,
Mhm.
right? How you see it. But there are also I think a limit too, because you can feel that it is your duty to care and it's really important, like many of us do. However, that may not be possible for everyone, right? To do that. And we shouldn't be judging others because they don't fill that kind of role. And I would say those who do step up do need those supports.
Thank you.
Thank you for sharing that.
And that ties into a final comment we have from Ann Kamau in Nairobi, implementing an IDRC and Global Affairs Canada funded project on caring for caregivers of persons who are living with NCDs. An observation we have made through the research is the reversal roles of caregiver, care recipient, at one point being a caregiver and the next care recipient. So we have many thanks and gratitude, expressions of gratitude in the chat, which for this wonderful presentation. We are at the end of our time together. So are there any final comments the co-presenters would like to make?
Maybe I'll just mention that my email I shared on the last slide, but I think maybe is also available anywhere. If there's groups that are tuning in that would have connection to multi-generational caregivers, we are using our professional networks to recruit for that second phase of our project. So we'd love to connect if your group might be able to amplify our pre-screening survey. And then also just appreciation that people came to this presentation. Very grateful for your interest and attention.
Yes, and yeah, ditto, and happy to share my email as well, but you'll get maybe a faster response. No, I'm pretty good. But yeah, deep appreciation for caring about this topic as well, because I think, and I appreciate you said you're coming from a lay perspective, but I think we all connect to this topic, whether we're studying it or because of the shared humanity, just to quote Dr. Shaw, that I think we all experience. And I think more caring societies are healthier societies and more equitable societies. And we have a long way to go in this country and many other places. So thank you so much for your interest, and always a pleasure to co-present with Kayla. Thank you. And thank you to Ben for organizing this session and promoting it. Thank you so much, and to everyone for joining.
And such gratitude to our wonderful interpreters, Lucia.
Yes,
Thank you.
thank
Yes,
very much.
thank you.
I'm sorry for taking so fast. I'm so sorry.
I know you never realize how quickly you
Yeah.
talk until someone tells you that.
I know. I also always have the nervousness, like speed talking. So, thank you.
Thank you.